I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. Today we're doing something a little bit different. We are talking about food and psychology. Normally we combine some type of true crime case. I am following because I believe from the Brandon Banfield case, I believe Juliana is being sentenced on Friday. So we will likely talk about that on Saturday. And I'm planning to talk about love bond versus true love. So that is the plan for our Valentine's Day stream. That is the plan for Saturday. Now, for today, I did just want to talk about mental health and food because there was some information put out about how a keto diet can be beneficial for people with schizophrenia. And there has been research for many different mental health conditions. And I will also just give a little disclaimer that this is not medical advice. People have to talk to their doctor because any type of change to how somebody's eating that can affect a lot of different things. And I've also seen people kind of balance between like a Mediterranean way of eating and then also keto. And so I've also seen people look at balancing the two of those. But with medication, particularly for schizophrenia and bipolar disorder, I commonly see clients gain a significant amount of weight because the antipsychotics and the mood stabilizers often have the person crave carbs. Like they normally crave junk food and like their appetite just gets really, really big. And sometimes before a doctor talks about adjusting the way a person is eating, sometimes they will just prescribe another medication or they may not do anything at all while the person has this change. And and so they have looked at weight gain and a person needing, first of all, higher doses of their medication. They might end up, their symptoms might get worse during that period of time. And so they have research that sometimes either a keto diet, specifically for schizophrenia, and then Mediterranean diets for individuals with anxiety and depression, they have looked into the role of what you eat and how you feel. And so things like your gut health. So when I'm meeting with a new client, I will sometimes ask them about how regular they are. Because if someone is really constipated, because sometimes with anxiety, physiologically, the person may not release as often, or they might have other symptoms. And so just making it a safe, comfortable place where we can talk about all of these different things. I am not their medical doctor. I am not their prescriber, but I'm trying to help them be able to communicate to their different providers any concerns, to look at different options, and then also just to make sure that that they are feeling a little bit better. I do have links to the different studies and articles that I'll be talking about. I do have links to those down in the description. And so here we have 5 things to know about keto. So they call it keto therapy, and this is on Stanford Medicine. They had an individual write this, and it's specifically talking about psychiatry and mental health. And so they've looked at some of the benefits, and once again, that individuals that do, especially if they gain weight due to the medication, that they can be at a higher risk for cardiovascular disease, type 2 diabetes, and stroke. And so in 2024, so a pilot study of 21 individuals. So 21 is really, really small. So anything that they found from this study, it's going to be really, really small. Carly, I'm going to save your question for a little bit later because that would take me down a rabbit hole, but I will come back to your question about ADHD and food. Okay. But with this study, they all these individuals were also prescribed antipsychotic medications. And after 4 months of a keto diet, most of the patients showed a significant improvement in their psychiatric symptoms, a reduction in weight gain from their medication, and also relief from their metabolic disorder. So I'm guessing that might have been type 2 diabetes or there was something going on with, they were diagnosed with a metabolic disorder as well. And that's not saying that the change in food is going to cure this individual, but what it does is that it does reduce inflammation. It does have an impact on the body, and what we eat can also impact how we feel. It really can have an impact. And so they have it here that studies have looked at keto on Alzheimer's, ADHD, all of those other things. I did not dig into that research. I was specifically interested in the schizophrenia, bipolar, for those two diagnoses, to talk about it from that perspective. Keto therapy stabilizes neurons and reduces inflammation in the brain. And they talk about exactly why it does that. And so this is just something that can be in addition. Now, when somebody is eating in a keto way for an extended period of time, because there can also be a downside to eating strictly keto. And so that's where working with a nutritionist, working with your medical team, if people are looking to make any types of changes. During my last video, I mentioned that there was a woman here on YouTube. I think it's Living Well with Schizophrenia, I think. She might have changed the name of her channel at some point. But she did mostly like a food change and had a significant reduction in symptoms, was able to reduce or come off most of her medication, but then ended up had a relapse of some symptoms and had to address that. And so, yeah, it really is fascinating to look at how these things can go. And gut health can be really, really important. So, uh, especially when we talk about, because like our immune system, everything comes from the gut. And with the new year, I started out with just one of those. So everybody does it their way, but I started eating more vegetables, eating more fruit. The goal was to eat less sugar. I'm gonna be honest, I didn't do the less sugar part. But I definitely wanted to increase my so eating baby spinach, and I like mixed greens. I do not like arugula. I'm not a fan. The way that some people can't stand cilantro, that's how I feel about arugula. Um, and then there's some people that do well on a very protein heavy diet where they are eating mostly meat and vegetables. I like to balance out a little bit of everything. All right. And so that keto therapy can help with metabolic syndrome and insulin resistance. Keto therapy should be considered supplemental to primary mental health treatment so that it doesn't replace mental health treatment. It might be something that can supplement. Um, and that as a person is, symptoms are improving, that they might just look at but like that they're going to continue their psychiatric medications as well. And so I do have a link to that down in the description. Let's see. But there is a need to continue to research it because the pilot studies, they show some promising results, some really high quality trials. So normally in a blind study, you would just have a group of people and you might assign them to different things. So one group might do Mediterranean, one group might do keto, another group you make no changes to their food, and that the researcher doesn't know which group is which. Um, and that the participant would definitely know because they would know like what they're supposed to eat. Because there's something called a double blind study where the participant doesn't know if they're receiving the drug or if they're getting placebo. That often happens in medication trials, but where the researcher doesn't know who's actually receiving the medication and the participant may not know. There are some things that it would be unethical for the person to not receive treatment. And so there are times where um, they don't have like a placebo group, but that gets into biomedical ethics, and we're not going there today. All right. Um, and so then with the Mediterranean diet, which is vegetables, healthy fats, seafood, that the effects that that can have on the mind is it can reduce inflammation, improve gut health, and you're eating nutrient dense foods, which can be positive. And some of the mental health risk, once again, from studies that they've looked at, reducing risk of depression, and that study was 1 point, like that was a large study. It was a pretty large study. Um, Found that 24% of people in the study that had the Mediterranean diet that they had a reduction in depression. Um, and so that it can help treat active symptoms, um, with those improvements lasting after 3 months, and that this can just be a positive thing. Now, when a person is depressed, they normally crave fatty thing. Like they might crave like junk food. They normally crave things like that, and that's where the DT scale to opposite can often be really helpful. So if I feel like just eating some junk, and if I eat something healthier, I might feel better after, versus eating the way I feel and then I feel worse and then things just kind of spiral down. Will a person eat perfect all the time? No, and that's not even the goal. But the goal is creating better habits and better systems. That's how you feel about kale. See, I don't mind kale in a smoothie, and I'll do some kale in a salad. I like it mixed in with other things, but not just straight if I can help it. Yes, yes, yes. And just the effect of, for some people, if, so I believe in healthy, so people being at a healthy size, but there are lots of people that, especially if their weight is causing medical symptoms like diabetes and things like that, and if it's affecting their health, that, sometimes addressing weight can improve mental health. But yes. All right. All right, all right. But I don't automatically assume that somebody is depressed because of how they look or something like that. Or I don't automatically assume that somebody is unhealthy because because of their size. There can be a lot of discrimination based on size. Even medical doctors sometimes not taking someone's pain seriously, not taking their symptoms seriously. Where if a person is in a larger body, the minute they go into the doctor, all the doctor wants them to do is lose weight, and there's not this bigger like there might be something going on that beyond the weight. And so in general, I'm going to throw this in too. It's really good to get the thyroid checked if people are having issues. There are tests that you can ask your primary care doctor for that kind of test out iron. So low iron anemia, that can make a person feel tired. It can mimic symptoms of depression. And a great thing to combat anemia is so there are green vegetables that have iron in it. I do a chewable iron, I do a chewable iron multivitamin every day. That's how I address my slight anemia. Vitamin D is really important, especially during these winter months, because seasonal affective disorder is real. Yes, yes. Low ferritin isn't on a standard iron panel. Thank you so much for mentioning that. Um, uh, and the psych medications alone can cause different issues and they can trigger weight gain. So Abilify is a huge one. Seroquel, Risperidol, the antipsychotics and the mood stabilizers are really common for increasing for we're just somebody being on it. I've known people to gain like 40 pounds in 2 months. 20 pounds in just 1 month after being placed on medications like that. Okay. And that can start to affect a person's self-esteem. That can start to affect other things too. Not always, but it often can. All right. And so we talked about the benefits of the Mediterranean diet. Good, good. All right. I also wanted to share this app. So I have been using this personally and I really like it. And this is not sponsored. I get nothing. It's a free app. Okay. So it's free. I don't pay for a membership or anything, but it's called Yucca, Yuka. So it is an app where you can, in the grocery store, you can scan different foods and it will tell you the rating, and you can also scan cosmetics. I haven't used it on cosmetics yet. And it can also give you a healthier option in the what's it called? In the app as well. And so when I was on Christmas break, so during Christmas, I have a family member that's been using this app and 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 we used that. So ferritin level is a protein that stores iron cells, and so you want it in a certain range, uh, and so that is what ferritin is. Thank you, Lisa, for asking. Yes. Ferritin is an iron-containing protein. Exactly. Thank you so much, J. Michael, for answering that one. All right. Um, and so just being mindful of and not that everything is gonna be perfect. So, I've definitely looking for salad dressing was like the Yucca app didn't like any of the salad dressing in Wegmans. It was recommending things in Trader Joe's, and our closest Trader Joe's with traffic is about an hour away, and so I'm not going there. And so I just find the best option in the app. It also points out if there are low risk, medium risk, or high risk additives. It also tells you the reason for each thing. Mama makes her own dressing. Hey, Mama. And so you ended up making your own dressing. So beginning of this year, I started doing the salad jar. I don't know when Mama started it, but I got these big mason jars, and I meal prep normally on Sunday, and I put the wet items at the bottom. So a little bit of salad dressing. I normally do tomatoes, peppers. I like jalapenos on my salad, and so I put some of those all at the bottom, and then the salad on top. And then I make between 5 and 6 of those at the beginning of the week, and then I'm able to do that. Hey, Mama. Ah, nice. So salsa. That's a really good option. So I've been making nachos this week. So I've been putting my salad and having some nachos too. Nachos are not, but I love nachos. All right. Thank you for adding that. I also because I added some avocado to my salad too, and I like guacamole or just avocado on my salad. It was delicious. Um, all righty. And so today's stream is going to be a I pressed the button and it kicked me out of the studio. All right. And so not that short. All right, good. And so what about with ADHD? Those medications, they destroy a person's appetite. And so my general recommendations in general, something I work with my clients on is possibly eating before they take their medication, which sometimes can be hard. So sometimes that's just like um, a protein bar or some yogurt or something that they eat something before they take their medication. And then they normally don't eat lunch. And then the medications normally start to wear off at a certain time and they'll start to get hungry. And so maybe they do a bigger dinner, or they do a dinner and a snack. Everybody, it just kind of depends on what works best for you to figure out what might be helpful. Um, but with ADHD medications, the stimulants, the doctors monitor for weight loss. For that's too much, because some people will not be eating enough to maintain. Sometimes with some clients, we talk about like if they are struggling to maintain their weight, they might do a liquid lunch. So they might do a protein shake for lunch, and then just finding ways to get calories and healthy ways to increase things like that for them. So those are general recommendations for things like that. Um, yes. um, Lisa, sometimes some herbs can not be so great for ADHD. Like it can affect thinking and things, and so that's where it just kind of depends on the person. I have had some clients that have sleep difficulties, and so they have CBD gummies or they have certain things that help them sleep at night. But that is my general information on that. So once again, on Saturday, we will be talking about trauma bond versus love, the psychology of love. That's my goal. And I hope that Juliana's sentencing, because it's supposed to be on February 13th. So I'm hoping that is streamed. If nothing else, I know that we'll have some news reporting on that. I am keeping an eye on Savannah Guthrie's mother being missing, Nancy Guthrie. My heart truly goes out to that family, and I do hope that she is found safe soon. The longer things go, the more desperate the family gets, I'm sure. The sadder, like your brain, you have to keep your mind from not going to dark places. I did see today that images of who they think disabled the cameras were released by the FBI today. And so I just hope that that progresses quickly. Also, with the Anna Kepner, that was the girl on the cruise ship where her stepbrother, they were sharing a bedroom, a stateroom on the cruise ship. I did see that he was brought in for questioning. And so I'm definitely keeping an eye on that as well because of his age. And I think it's in federal court because it happened while they were out at sea. So that gets into federal, international waters. So I don't know that all of that information is going to be made public, but I am keeping an eye on that one as well. And so I adore you all in the chat. That's why I do these live. I'm gonna go get ready for dinner. I hope you all enjoy the rest of your day. If there are topics that you would like for me to talk about, make sure to put them over in the regular comments. I do keep an eye on that. Sometimes I will do a short video or I might do a longer video, but I hope you all enjoy the rest of your day. Bye.